Do you wake up with neck pain, tight shoulders, or lower back stiffness and blame your pillow? Your sleep position might be the real reason, because the goal isn't to a perfect position, it as spinal alignment from hips to head. Today you'll learn the best sleep position for your body type and how to fix it using only pillows so you sleep deeper and wake up better. The best sleep position is the one that keeps your spine in a neutral, supported line and reduces pressure points. Side and back sleeping are generally considered healthier than stomach sleeping because they make it easier to keep the spine supported and balanced. Choose your base position, side versus back versus stomach. Side sleeping is the most common sleep position, and it is often recommended for spinal comfort and for reducing snoring or sleep apnea symptoms in many people. Back sleeping can help keep weight evenly distributed and may feel best for some people with neck or back pain, but it can worsen snoring or sleep apnea in some. Stomach sleeping is the least common and often strains the neck and lower back, even though some people feel it helps with snoring. Best position by body type. 1. Curvier hips. Pear-shaped hips wider than shoulders. Side sleeping usually works best, but the key is filling the gap so your top leg doesn't pull your spine into a twist. Use a pillow between your knees to reduce strain on the lower back and help keep hips stacked to broad shoulders. Inverted triangle shoulders wider than hips. Side sleeping can still be great, but shoulder width often requires a pillow with the right loft so your neck stays neutral. Choose a pillow thickness that matches the distance between your neck and shoulders so your head doesn't tilt up or drop down. For a larger belly, central weight, more pressure on front of body. Back sleeping may feel uncomfortable for some larger bodies because lying flat can increase pressure on the abdomen and hips. In that case, try side sleeping with knees slightly bent and support pillows to improve comfort and alignment. For both side and back sleeping can work well. Focus on neutral alignment and pressure relief if side sleeping causes shoulder pressure. Adjust pillow height and consider a softer surface or added cushioning to reduce pressure points. Your spine should look like a straight line from your shoulder gives hip side or feel evenly supported back. Lower back pain. Many people do best on their side with knees slightly bent, and a pillow between the knees can reduce lower back strain. Neck pain. Back sleeping can reduce overactivity in neck muscles for some people, and using a lower loft pillow can help keep the neck neutral. Snoring. Suspected sleep apnea. Side sleeping is often recommended because it may reduce snoring and sleep apnea symptoms compared with back sleeping. Acid reflux. Side sleeping may help, and some sources note left side sleeping can be more effective than right side for reflux in certain people. Quick pillow formula. Side sleepers. Keep knees slightly bent, place a pillow between knees, and use a pillow loft that keeps your neck level, not tilted. Back sleepers. Try a small pillow under your knees to reduce stress on the low back and keep the spine comfortable. If you must sleep on your stomach, use a very thin pillow or none to reduce neck strain because stomach sleeping tends to twist the neck. Better sleep isn't luck, it's alignment, support, and small adjustments done consistently. If this helped you, like this video, share it with a friend who wakes up in pain. Follow for more wellness tips, and subscribe for weekly content that upgrades your health one habit at a time.